Hi, this is Gayle Palmer from the Living Elements Clinic in Siddlesham, and today I wanted to introduce you to Lissie Evans, who is also going to be working at the clinic, and we wanted to talk about the principles of osteopathy, what osteopathy is based upon and why it works as well as it does. And there are 4 principles, and we're just going to talk about one of them in this video, and then we'll do the other ones too. So one of the first principles that we have is that the body has an inherent mechanism to heal and rebalance itself. Okay, you may not think of that as a big deal, but if things don't work, you suddenly discover that your cut keeps bleeding or things keep hurting, but we forget that actually they heal, and we don't realize that as an amazing function of our bodies. So tell us, Lissie, if you can, and I'll help as well because it's a joint effort, what it's like to treat and heal someone using those mechanisms.
Yes, well, still originally used to say the body has its own medicine chest. And at first, when you start at osteopathy school, you think, what does he mean? And then, particularly if you are like Gayle and I, and you work in the cranial field biodynamically, you will get to understand that whatever any of us are doing and however we're injuring ourselves or working with pathologies along the way, that the body always does heal itself. And what we do is set the body up so it can heal itself. And every night when you're asleep, hopefully, between about the hours of 1 o'clock and 3 o'clock in the morning, all these self-correcting mechanisms in the body are coming into play. And things like the arterial circulation, how your blood pumps itself around the body, will slow down and almost stop and reset itself so that you start the next day with the best possible pulse, heart rate, and blood pressure that you possibly can have. And that happens with absolutely everybody. So one of the first things, and it's a question we always ask when we're taking history, how are you sleeping, is to make sure that you are actually deeply asleep early
and able to use those healing mechanisms that your body does automatically, but actually it comes into play and is able to perform its function. Otherwise you become more and more depleted, and your system struggles more and more as it tries to regain its balance and its homeostasis, which is that balance between health, ill health, feeling great, not feeling quite so great, in any tissues that we are working with.
Yes, we're looking for the balance point of perfect normal. So it will always come into play, and it will always be trying to get to a perfect normal, even if you are very, very ill indeed.
Yeah.
And it's having your hands on and being able to palpate, to observe mentally, it can actually be a lovely experience for us as osteopaths, because when the body is trying to be perfect normal, it's a thing of beauty, and you share that beauty by observing it in your patient.
And the extraordinary thing is, your body is always on your side, and it will always aim to go towards better health if it possibly can. Sometimes it gets stuck, and that's where the osteopath is able to bring more of our skills to play to start to get those healing mechanisms to work for you.
And when it's not working very well, you often get inflammatory procedures building up in the body. And so when we ask you questions about how much water you're drinking, because we want to get you properly hydrated, when you get your aches and pains, and when you're doing what movements, etc., and when your joints are giving you GIP, we might advise you on your diet, and we might give you some exercises as well as treat you. And it's all about making your environment the best it can be, so that your body's natural inner self-correcting mechanisms can work as well as they can.
Cool. So hopefully that's given you a better understanding about one of the principles that guide osteopaths and the healing mechanisms within osteopathy, and I hope that's been useful.
Yes, and if you have any questions when you come in for a treatment, we'll answer any question.
We certainly will.